All right, so thank you for joining, everyone. We're going to talk about your diabetes and your physical wellness. Let me just share my screen and bear with me.
I'm seeing you typing. Is that
Yeah,
supposed to be?
it timed out. Here we go. Okay, so diabetes and your physical wellness.
Okay.
As long as the thing works now. Hold on. Bear with me. Oh, okay. So to start off with, let's talk about your body and diabetes. So, diabetes is a microvascular disease. So, with that, we know that it affects all the blood vessels in our body because it's a disease where your blood sugar is elevated unless you take medicine, watch your diet, or take insulin to help that. So, understanding that hyperglycemia, high blood sugar, speeds up the damage and builds up plaque in your blood vessels. So that's why it is considered a microvascular disease. And because of this, it's in every blood vessel of your body, even those in your organs. So in your heart, your kidney, your eyes, and your entire body circulation. So when we put it in terms of that, the best way to protect your body and keep it healthy is to avoid hyperglycemia. So it's really the high blood sugar that does all the damage. So if we can keep our blood sugars at an even keel and low, within normal range, then we're protecting ourselves. So keeping track of your daily blood sugar is essential, as well as your A1C, your blood pressure, and your cholesterol. So these will be your ABCs of your diabetic plan. It's the ABCs. So now just refresh my memory. How many of you, Mr. Hillman and Miss McQueen, are you testing your blood sugar?
Yes.
Okay.
Yeah, yes.
Okay. So you have a glucometer that's working and you're
Hmm.
documenting the readings in order to so that you're aware and that your healthcare team is aware.
Yep.
Yes.
Perfect, because that's helpful. Um, okay. So the first thing we're going to concentrate is knowing your A1C. So I know we've discussed this before, so I'm just going to remind you that it is a test that is run every 3 to 6 months, depending on what your provider wants. Some providers want it every 3 months, some providers want it every 6 months. It's really individualized and based on what your number is, and your age as well. So it has to do with your age, if you have any other chronic conditions along with your diabetes, and how well controlled you are. There's a lot that goes into it. So your provider, your PCP, will be the one to tell you if you need it every 3 months or 6 months. And what it provides is an average of your blood sugar over 3 months. So, and it's measured in percent. So it can give an average by looking at your hemoglobin, which Mary did a great job describing. So it looks at your hemoglobin and looks at the sugar on your hemoglobin itself, and by peeling the layers of sugar off of it, it can give you like a percentage of where your blood sugars typically are. So doctors and providers use this to guide good control. So good control is 7%. So that's usually the target number, but again, can vary based on individuals. So some patients may have higher, they may want it at 8% versus 7%. There are patients, obviously, that have pre-diabetes as well, where they're in the sixes. So the doctors want them to get below, and that's usually controlled by diet and exercise. The doctors would want them to be below seven, even, and below, lower sixes. So it's very specific. So just know to have a conversation with your PCP on what your A1C should be.
Hmm.
And keeping your A1C within range can reduce the risk of developing diabetes complications. So that's really, really important. There is a correlation between good control. So the lower your hemoglobin A1C is, the lower risk you are for any other complications. So that's a really important measure to keep in mind, and that's why it's A in the ABCs of your diabetic action plan.
Hmm.
So let's see. Blood pressure. Okay, another important number. So I don't know if Mr. Hillman or you, Miss McQueen, are testing your blood pressure, because I know this is focusing on diabetes, so I'm not sure about your blood pressure status. But are either of you measuring your blood pressure at home, or when you go to the pharmacy? They have the blood pressure reading. machines?
I,
Um, go ahead. Go ahead. I'm sorry, Mr. McLean.
when I go to the pharmacy, yeah, I normally use their machine.
Okay. And so are you familiar with where your blood pressure usually is?
Yes,
Okay.
it's still the same. My blood pressure would be around 140 over 70 or
Okay. Okay. And how about you, Mr. Hillman?
I just usually get it when I go see Dr. Joseph, but I do have a blood pressure machine in the house that I used in the past, so I'll pull it out out of its place and start using it again. I have to
You
start
can.
doing.
You don't have to go crazy. It's just good to know where you stand. And
yeah.
if you do see it,
Yeah.
spot check it every once in a while. And if
Yep.
you do see it going up, we want to keep track of that because we want it to keep be low.
Right. Right. Right.
So the number to look for the two of you would be below 130 over 80.
Mm-hmm.
Yeah.
Again, this is to protect your blood vessels in
Okay.
your heart and eyes and kidneys and your brain as well. Right, with the higher blood pressure, you have the blood vessels in your brain as well. You don't
Yeah.
want anything to
Mm-hmm.
happen to with
Right. Mm-hmm.
so the lower the
Mr.
number would, especially when you're diabetic, the better. I know
Mr.
typically,
Hillman, I just want to, I know that you have a blood pressure cuff at home.
Mm-hmm.
You also look like a big guy.
Yeah.
You need to make sure that your blood pressure hits you correctly, because if it doesn't,
Mm-hmm.
it'll give you inaccurate numbers.
Okay. Yeah. I was thinking about that. I'm looking at the cuff. The cuff, it seems like it fits, but I wish I had a bigger one.
You can get bigger ones,
Okay.
okay?
All right.
Just
Yeah.
saying, just saying.
yeah, thank you,
Yeah.
Mary.
I'll look into that. Yeah.
So the target number then for your blood pressure, which is B in our plan, is below 130 over 80. Now, what can you do to help yourself lower your blood pressure? So you can limit your salts, watch your weight, and exercise and medication as well. This will all contribute to lowering your blood pressure. So for you all, I'm not sure if you're on medication for it, but everything that we're doing in this program, we're talking about the food we're eating. We can limit the salt. Salt is really not healthy. Added salt is really not healthy for anyone. So limit your salt. Watching your weight, we're watching that as well, just because we're watching what we're eating, we're exercising. So it would be good to watch our weight just to see if the changes that we're making are impacting our weight. So, and odds are they probably will be. So that's great. So, and we're talking about exercise today. So we are already on the road to watching all of this stuff. Okay, cholesterol. So cholesterol is tested once a year, typically once a year. It may be tested more if you have high cholesterol, they may test it more often, but it's at least once a year. And it helps to determine if you have a higher risk of forming plaque. So the more cholesterol that you have in your blood will, along with the high blood sugar, add
Hmm.
to the plaque that may accumulate in your blood vessels. But it can be managed with healthy eating. So your body makes cholesterol. So some people make their own cholesterol and in higher doses. So everybody's body can make cholesterol. However, some people make more cholesterol than others where medication might be necessary. For most of us, diet can control this. So we really just all need to focus on healthy eating and exercise to manage the cholesterol, as well as medications if indicated. So I listed normal values. You may already know this. So your total cholesterol would be 200 or lower. LDL, which is the lethal. I always called it the bad cholesterol, but lethal is easier to remember because it starts with L. So LDL
Hmm.
is least lethal, less than or equal to 100. So we want something 100 or lower. HDL, or the happy, healthy cholesterol, is greater than 40, and triglycerides are 150 or less. So that's just for your records. Managing your cholesterol and triglycerides can help prevent heart disease. So, yes, very important overall to manage your cholesterol. Keep that in mind. And this is something your doctor is well aware of and is monitoring regularly. So, and you would know if he needed to test it more, or if you needed medication, they would reach out to you as well. So, just always be mindful of the cholesterol and healthy eating, those foods. Going back to the label reading that Mary was talking about. So we're going to look at total fat and saturated fat, and trans fat. All of those would impact cholesterol. So we want to make sure that we have no trans fat, no saturated fat, and then for total fat grams should be pretty low. So
Okay.
go back to reading labels. It's funny, once you start reading labels, you don't stop. So just letting you know that, because that's how I found it with me. Once you start reading labels, you never stop. So it's a good skill to have. Okay, blood glucose monitoring. So I know you both said that you are testing, which is great, and you're tracking. So
Right.
that's great. Now, are you tracking on paper, or are you tracking on an app, or how are you guys tracking?
I'm writing mine down
Okay.
Yep. On my,
because when I go see Dr. Gallagher, I like to take her, show her my numbers,
Yeah.
and if I have any concerns, I bring it to her attention or whatever. But
Perfect.
so I like to write mine down.
Yes, and that's great. And you can also make notes. I always like writing them down too, because you can easily make notes. If you have a high, you can write down what you ate, because that's helpful too. And that will be helpful for you tracking.
Right.
You know that pizza elevates your sugar by 100 points, then you will be mindful of how much pizza you're eating then. So
Right.
it's really good tracking that way. Um, and Mr. Hillman, you write it down as well?
yes.
Okay. Um, and then you decide with your provider how often. So that is very individual. I'm sure the two of you may not even be the same for the amount that you track
Mhm.
and the amount that you test your blood sugar with using the finger stick machine. That's very individual. That's really between you and your provider.
Mhm.
So I'm glad that you guys are keeping the conversation open about that. All right, so mind your ABCs. Oh yeah, I have to bring this quote, Benjamin Franklin. I love this quote. An ounce of prevention is worth a pound of cure.
Wow.
And it is so true. I thought it was so fitting for what we're talking about. And I have seen it, and I'm sure Mary can speak to this too, because we're both nurses. But the more that you take care of your body and do, take preventative measures, really it makes the impact it makes is overwhelming, at least from my experience. How about you, Mary?
Oh, absolutely.
Yeah.
And managing diabetes,
Yeah.
the purpose behind it is to obviously feel well, but it's also to prevent the long-term complications.
Right.
So you're in the driver's seat, and like diabetes, in my opinion, is probably the most self-managed disease that's out there. You control what you stick in your mouth. You control how much exercise you do.
Right.
You're in charge of this one.
Yep. And I
Wow.
always love to tell patients that, because I've had patients that are newly diagnosed, and I'm sure Mary can speak to this too. And it is scary. When you first get the diagnosis, it can be overwhelming and scary. And even throughout having it, you can get overwhelmed at times. But if you step back, maybe do some relaxation techniques that Danielle showed us. If you step back and you think about it, it is in your control. So I always tell patients that, even when they are overwhelmed, take a step back and realize it is in your control. So there's so many things that you can do for your own diabetes. That's why it is worth making a diabetic action plan, because, like Mary said, you're in control. So it's all about minding your ABCs, which are the A1C, your blood pressure, your cholesterol, and monitoring your finger sticks, your blood glucose test at home. Okay, so taking your medication as prescribed will assist your body in controlling your blood sugar and blood pressure and cholesterol, and it is tailored to your specific health needs. So it is really important to take your medicine as prescribed, because each of you have your own medication regimen specifically for you.
Right.
Really important to take the medicine as prescribed. Preventing dry skin, moisturize often. So this is really important for diabetic skin, because we want to prevent any cuts, any scrapes, in order to minimize any infections. So we know when you have diabetes, there is a higher risk of infection. Your body doesn't heal necessarily as quickly. It heals a little slower. So
Mm.
we want to avoid any chance of infection that we can avoid. So treating cuts and abrasions immediately by cleaning the area, applying antibiotic cream. But if we moisturize, we can prevent some of the openings. We're putting our skin in better condition. So some
Mhm.
of these scrapes and cuts may not happen as easily if we're moisturized. So I thought that was important to put in there, because not everybody thinks of it. I don't often think of it. So I thought it would be good to just remember that. Okay, so early detection. So early detection is another way of preventing complications. So we want to make sure that we're seeing our eye doctor at least once a year, because you can have eye damage even if your vision is fine.
Mhm.
So that's really important to realize. I also need to practice what I preach. I need to go more often, because that's the doctor I tend to go to the least. So going to the eye doctor, just keep that in mind. You never know what's going on with your eyes until a professional looks.
Yep.
This is one of the appointments where if you go to the eye doctor and the eye doctor says, come back in 3 months, you want to go back in 3 months. Because sometimes by the time you realize that there's a problem, it's that much more difficult to take care of. That is an appointment that you keep.
Mhm. So if they also offer to make you an appointment before you leave, have them make you an appointment before you leave. And then put it on your phone or on your calendar at home, put it wherever so that you remember to go. So that is true. Thank you, Mary, for saying that.
Yep.
A physical as well. So physical or annual wellness is yearly. And it is super important because it includes a lot of tests to evaluate your kidney function, your blood pressure, your cardiac function. A lot of times they'll do an EKG, they'll check your blood pressure, they will do blood to check your kidney function. So they listen to your heart, they check everything. So really important to have a physical. And I want to bring this up because I've seen this so many times when I was working in a doctor's practice that patients would come to the follow up for diabetes, right? You go to a follow up, let's say every 3 months. You
Mm.
don't realize that's just a follow up for diabetes, usually. And a physical is a bit different. So you want to make sure that you are scheduling an appointment at least once a year for a physical. So it's a little bit, it's more comprehensive and it's not just focused on diabetes. So I just want to bring that to your attention because I've seen it so often that people are going to the doctor, like going to the doctor. So they are assuming that the physical is being done, but it's not. It's a lot of the time it's just focused on diabetes. So just keep that in mind. You want to seek medical attention if you feel pain, numbness, or tingling, as well as any problems with your digestion or bladder, which can be signs of nerve damage. So that's another thing. So to protect your nerves, because once you have nerve damage, and Mary, correct me if I'm wrong, once you have nerve damage, you really can't get it back. So you want to, any of those problems with digestion or bladder, can you want to get that checked out.
Mm.
Absolutely.
Yeah,
Absolutely.
nerve damage can't be, yeah, the earlier you get you detect nerve damage and it's treated, the better outcomes you're going to have. Visiting your podiatrist or foot doctor regularly. So this is super important as well, because if you're having any sort of nerve damage like neuropathy, you want to have a professional look at your feet, like just to make sure you're not missing anything. Because I don't know, I know you have family, a lot of you may have family, maybe you can also check your feet, but go to the foot doctor regularly. They can trim your nails because ingrown toenails can cause a problem. The bottom of your feet, in between your toes, the podiatrist checks all of that just to find problems earlier. So I've seen that as well. The earlier you get to the foot doctor with a problem, the better. You have a sore in your foot, go immediately.
I um I told you guys the last time I did meet with you guys, I had met with my podiatrist and went and got my feet checked, my toes, everything were good. But I was telling him I was having a little numbness in my big toe.
Mhm.
So he suggested that I start taking the B12.
Okay.
So since I've been taking the B12 pills, I've been on them the past 2 months. My toe been feeling much better.
Oh, excellent. That's great.
So he
So, I
told
mean,
me to,
sometimes there are other reasons for numbness or tingling. The issue is when somebody has diabetes and somebody's complaining of numbness or tingling, it automatically is assumed, it's the diabetes. It very well may not be, but that's where you need to go see somebody to help you figure out what the story is.
yeah, the podiatrist told me the B12 will enhance my medication. He said about the metformin that it would enhance that more. And with the
Okay.
B12, it's good for the vessels, for the blood flow.
Yep.
So, but actually, like I said, I haven't had that feeling since I started taking the B12. So
Good.
I take them every day.
Good.
That's great.
One tablet a day. I put up under my tongue because it dissolves. So
Okay.
yeah.
That's good to know. So that is something, if Mr. Hillman, you wanted to ask the doctor, you could check it out first before taking
Yeah,
it.
I do. I'm on the B12 too. My doctor told me the same thing. I take it every day, and it helps. It
Great.
helps a lot.
Oh,
Yep.
great.
Hmm.
Okay. So this is all great. We wanted to put that little disclaimer that before you take any of your medication, just check it with your doctor to make sure it doesn't interact with any of your other medications.
Right. Mhm.
Right.
But that's wonderful. Thank you for sharing that, Ms. McQueen. That's good to know. And Mr. Hillman. Okay, so who will help you? So this sounds like a lot, but like Mary said, and I'm saying too, it's all in your control. It's just about keeping these things in your mind and knowing how to prevent complications, as well as going to see your doctors for early detection. So your PCP is the gatekeeper. I always say the quarterback of the football team, the gatekeeper, whatever you want to say. But your PCP is the one that you go to first and the most. Sometimes I've seen, at least in the practice that I was in, that before we even sent to a specialist, we would help our patients control their diabetes. So that's always recommended. Sometimes if your primary care provider has tried a lot of treatment and you don't really seem to be responding, not you personally, but your body doesn't seem to be responding to it, they may send you to an endocrinologist, but the PCP is always the quarterback. So you always go back to the PCP and keep the PCP in the loop. A podiatrist, we have discussed this, so the podiatrist will help you as well. Dental exams are extremely important to everyone. They say really good oral health keeps your body healthy. So dental exams are important, and every 6 months to a year, you should have a dental exam.
Mhm.
Ophthalmologist or the eye doctor should be seen yearly. So we did go over this with prevention or early detection of conditions, but I just wanted to say who your team is and who you should go see regularly. Okay, so what
I
can
have,
you do?
I'm sorry. I have a
Yes,
quick question. Do we have a dentist in the
in the network, Englewood Health
yeah.
Physician Network.
Hmm.
Not that I'm aware of. I can bring that back as a takeaway. I'll double check.
Okay.
There may be one in the so
I,
go ahead.
Christine, I think we just got one.
Okay.
Oh, really?
Yeah, I think we just did. I'll have to double check, but I'm 90% sure.
Okay.
Okay, good to know. I was going to take it back to check too. So, okay, that's
Okay.
great. Mary and I will look into it because I
Okay.
don't know the
Appreciate
answer.
it.
So that would be something useful to know.
Okay.
That's great. All right, so what can we do? Avoid hyperglycemia, right? That's the key indicator. If we can keep our blood sugars controlled, you stay much healthier, and you may avoid plaque from building up, and you might avoid damage to your blood vessels, your organs, your eyes, your heart, your kidneys. So we want to avoid hyperglycemia by limiting carbohydrates. So, and we've spent a lot of time talking about that. I know Marilyn and Mary did 2 nice presentations. So we know that limiting carbohydrates, we know how to read labels and how to look at the grams of carbohydrates and which are better choices and which are not. So we can work on that. Eating lean protein, I know is also discussed. So fish and poultry are leaner than beef and pork. So we want to make better choices with protein. We want to decrease salt. So cook with less salt, remove the salt shaker from the table, and read labels. Drinking lots of water, 6 to 8 glasses. So how many, that's a question. How are you guys doing with your water intake? Do you think that you're drinking 6 to 8 glasses?
Yes, I do. I definitely, that's all I drink all day is water.
Okay. How about Mr. Hillman?
Same thing. I drink a lot of water.
That's good. So I do too, or I thought I did, until I had to measure how much I was drinking.
Mhm.
And then I wasn't really drinking, even though, like, and even now, the water's sitting right in front of me, but I never drink it. So I have to be consciously, like, I literally need to see it so I can drink it. So, what I did just to measure what I was drinking is I had a huge, I think, 3 liter bottle, plastic bottle. I don't remember, just a generic, like you can get it in ShopRite, a plastic container,
Mhm.
3 liters. I filled it. And then I monitored how much I was actually intaking from that 3 liters. Did
Mhm.
I finish it in a day or did I not? So it took a while. But I have to conscientiously make myself drink in order to get that much water. So I'm just throwing it out there because I don't know if you're like me, but I thought I was drinking a lot, but you may not be drinking as much as you think you are.
Right. And that brings up another question. Should water intake be based on like your body size? Because sometimes I think I'm probably not drinking enough, even though I drink a lot of water, but maybe I'm not getting enough water for my body size. You know what I mean?
Right. So Mary, you want to take a stab at that? I don't know per se. I would
So
say,
reality is it's still going to be roughly 6 to 8.
Okay.
glass of water. Okay.
Okay. Okay.
But, when we're talking about a glass of water, we're looking at, at least 8 ounces, which is a cup.
Hmm.
All right. That's at least 8 ounces. So
Mhm.
basically, we're asking you to have at least 8 cups.
At least 8 cups. Okay.
So that would be, if you want to try my trick where you have a container that you pour literally 8 cups of water in, and then you can measure, you can actually see if you finish that at the end of the day.
Hmm.
That's how I was able to see that I was not, even though I thought I was drinking enough, I wasn't.
Right.
So maybe worth it just to try, not do it all the time, but at least have an idea. You can visualize then if you're really doing what you think you're doing.
Hmm.
So weight reduction, where, I'm sure nobody's alone here. We all know weight reduction, losing 10% of your body weight will improve your numbers. I've seen
Mhm.
that multiple times. So it just 10% really helps a lot. Exercising. So when we say exercise, it doesn't necessarily mean going to the gym or doing a whole routine. It just means get moving. So anything that you find enjoyable, just get moving. Get your heart rate up, get the circulation going, and it will really help your organs and your body stay healthy. Quit smoking. I don't know if we have any smokers, but anybody that smokes with diabetes, really, nicotine causes vascular changes. So it's not healthy for anybody, but especially if you have diabetes, because you already have microvascular disease. So the nicotine causing vascular changes is only going to make it that much worse.
Hmm.
So, okay. And what more can we do? So foot care at home. So I just wanted, this is daily routine stuff that we can do, that you can do at home. So checking your feet every day. Wash your feet, don't soak them. So if you soak them, it will actually dry out your skin and make it more prone to cuts and cracks. So we don't want to soak them. Moisturize, we talked about that. Moisturize the tops and the bottoms, not in between the toes. Because if you moisturize in between the toes, it's just gonna, it could breed fungus. So just the tops and bottoms to protect your feet. Trim toenails straight across. Wear comfortable shoes and socks to protect your feet. There are diabetic shoes. Mary, do they have to get that from a podiatrist or can they get that from their PCP?
They can get it from their PCP.
Okay, so if anybody wants the diabetic shoes, they're made a little differently, so they're kind of boxier. So there's less rubbing on the feet. So, and you are entitled, now Medicare puts limits on it, like one a year or something like that. And I'm not sure with regular insurance if it's paid for, but it may be something to look into, diabetic shoes. And check the insides of your shoe each time to make sure that there's nothing in them, no loose objects, that they're smooth, nothing sticking out that would hurt your feet. And you want to avoid bare feet. My mom's been diabetic her whole life, so she never wears, I've never seen her in sandals, except maybe on the beach, but that's it. So you want to avoid bare feet as much as you can, because if you are having any numbness or tingling on your feet, you don't want to take a chance of getting a cut or opening that skin and causing a infection of any sort. So avoid bare feet. Okay, diabetes and exercise. So diabetes, it's very important to exercise for anybody, but especially with diabetes, we want to keep that circulatory system going and healthy. So diabetes raises your heart rate and it causes your body to use insulin more efficiently. So it will help your diabetes because it will help your body use the insulin better and lower the blood sugar naturally. The increased pumping of your heart improves circulation, gets the blood moving to all the organs, and it lowers your LDL, the bad cholesterol, the lethal cholesterol, and
Mhm.
it improves blood pressure, reducing your risk for heart disease. So it helps your diabetes and reduces your risk of heart disease. More benefits of exercise. It is a natural stress reliever. It makes you feel happier by releasing positive chemicals in your brain. Exercise increases fat and protein metabolism, which increases weight loss and slows organ damage. So it is a protector. So it makes you happy and calm, and it protects you. It helps you look, feel, and sleep better. Okay. Oops, sorry about that. Did I skip? Okay. Good health visible on the outside. So I just wanted to throw this quote in because I think it really spoke to me when I was looking at exercise quotes, I guess. I do want to look good still. I do want to be healthy. So good health is visible on the outside, and exercise helps us have good health. And taking care of our body helps us have good health. So we want to look good and we want to be healthy. So getting started. So I already talked about the first one. Find joy in movement. So choose something that you enjoy to do. Dancing, walking, bicycling, swimming. Dancing is fun. I like if you have a partner to dance with, even if you don't, just dancing, just listening to music and moving your body. It's a really good stress reliever. It makes you happy. So it's really, really fun. Walking outdoors. I know we were just speaking about that. Sounds like both of you enjoy walking and outdoors. When you walk outdoors, I find when I walk outdoors, I was walking in the gym on a treadmill. It did not do nearly the same thing that it did walking outside. Breathing the fresh air in nature, it just does something again, mind and body and soul.
Mhm.
Using baby steps. So begin slowly and work your way up, gradually increasing intensity. So I'm going to use you as an example, Miss McQueen. I know that you said you go for a 30-minute walk in the morning and a 30-minute walk in the evening.
Right.
You could possibly I don't know, add weights, and I'm sure John can speak to this. So I'm just giving an example, but he'll get more into detail. By adding intensity, either you could change your route to go up a hill, make it more hilly and get some intensity there. You could walk using hand weights or little weights on your ankles to add more intensity.
Mhm.
So it is good to keep that in mind as well. I have to work on this as well because I feel like I do the same walk every night, which is fine, but you still, got to get that intensity in there and work some muscles. Use the buddy system. It's a motivator. So, and I use this. So we all get busy, and I know every one of us has that. So I have a friend that I walk with consistently every week. So she reaches out. If I don't reach out to her, she'll reach out to me so that we get our walk in every week. So that's at least, and we do this once a week just because we can. That's the only time the two of us can walk. I try to walk without her as well, but at least I know once a week that I will definitely get a walk in because I have somebody looking out for me, and I'm looking out for her as well too. So it's definitely a motivator. Make time for exercise. So put it on your calendar at a certain time so that it becomes part of your schedule. This has worked for me. I'll bring in my own experience. This has definitely worked. So the friend that I walk with, it's Sunday nights. We tried every other night. Every other night something came up. So Sunday was the only time that we could both put it on our schedule and commit to it. Also include exercise in your daily activities. So even on the days that it's not a Sunday for me, I try to include more activity by walking the dog, parking farther away. I definitely do that. And it's better for your car because you're not parking near anybody. So speed cleaning, I've done that as well. So you get your heart rate up by like just cleaning the house really quickly. A great time to exercise also, I just want to throw this in there, is after a large meal, and Thanksgiving is on Thursday. So we have lots of opportunity there to take a walk. They actually have, I don't know if you've heard of the turkey trot. I know a lot of running groups do turkey trots. So my husband's been doing it, and I always asked what it was about, and it's because you exercise before the large meal. So either before or after, but everybody knows Thanksgiving is the biggest meal of the year. So everybody tries to include exercise some way or another. So just do a little turkey trot of your own, whatever works for you guys. Okay, caring for your body during exercise. You want to test your blood sugar before and after exercise if you are on a medication that causes hypoglycemia. So insulin, some oral medications may cause low blood sugar. So just keep in mind your medications. And hopefully you have all heard from Anna, the pharmacist, and she can also identify which of your diabetic medications, if you are on any, may reduce your blood sugar. So that's important for you to know because it will guide you. So you either, if your blood sugar is low before you exercise and you're on a medication that will make it lower, you have to eat before you exercise. If you're at a good number, not too low, not too high, bring a carbohydrate, a snack with you just in case you feel like you're dropping.
Yeah, I know that feeling.
Yeah. You want to go ahead. What were you going to say, Mr. Hillman?
Well, I was going to say I've been there before, so I'm aware of that.
Yeah. So I bet now you carry a snack with you.
Oh yeah. I know. I usually I'll either do something before I leave the house, like snack on something before I leave.
Mm-hmm.
You know what I mean? But or I'll have something with me just in case.
Right. Okay.
Yep.
And then you want to drink. So I know we spent a lot of time talking about water and making sure we're drinking enough. You want to drink while you're active to prevent dehydration as well. You want to wear, to protect your feet, you want to wear cotton socks, comfortable clothes, and athletic shoes that fit well. And check your feet after exercise to check for sores or blisters or irritation or any other injuries. And then you want to track your activity. So your Fitbits, Mr. Hillman, I know that yours is already tracking, so that's great. And Miss McQueen, when you get yours up and running, you can track your activity right on the Fitbit.
Okay.
So like I said, it may be interesting for you on those walks to see how many steps you actually get during your walk.
Yeah.
Unless you have an idea. How far do you walk? Do you know?
At this time, I do a half hour. Like I'll look at my clock. I do a half hour.
So it will be interesting because it'll tell you your distance then. It'll tell you your steps and your
Right.
distance. So that's great. And your heart rate. So you can track your intensity.
Okay.
So, okay, with that, and I was kind of rushing, so I'm sorry about that. I want to make sure that I have enough time for John, but any questions that you may have? I know we talked a lot during my presentation, which is great. Any final thoughts or questions?
No.
I do have a question.
Yes.
Do we have because like as far as stretching, you know what I mean? Like sometimes my body gets tight and it gets tense, and it helps me out if I'm loose, if I stretch out. So do we have anything in the program where someone could, like, I stretch out myself, but you know, there's some stretches that where you need somebody to like stretch your quads or maybe your hamstrings or something. Like sometimes you need assistance to get like a real thorough stretch. So do we have anyone that could do that for us?
I think that might be a John
Yes,
question.
John, I'm sure is going to speak to warming up and appropriate exercises for warming up. So with that, I'm going to introduce John.
All right.
Are you there, John?
I am here. Is my video on?
Yeah,
Yes.
let me get to it. I have it.
Okay, cool. I'm also I'm gonna log in again just so I can see and present at the same time. So I'm jumping in on another device, so I don't want to confuse you.
Okay, hold on. So I'm going to stop my screen sharing.
Okay, cool.
And we'll see if John can get his. Oh, do you want me to make you host?
Yeah, you can make me host so I can bring up my slides. But while you're doing that, I'm also gonna log in as another participant if that's okay.
Yes, that's fine. I'll make you host right now.
Okay, cool.
This is how we practiced yesterday, everybody. So, because I wanted John to be able to have capability to show his slides because they're awesome. So,
Awesome. Hopefully it works.
your host.
All right, so I'm gonna share my screen in a couple seconds here. So disregard some of this other stuff. Hopefully I got to jump over to my thing here.
Okay.
And keep me honest to see if you guys see the presentation, hopefully.
We see it.
Okay, cool. Present on this device.
Yep.
All right, let me see. It's going to take a while to upload. So while that's upload, I'm going to join in without video as another participant.
Okay.
Cool. Oh, no.
There's a lot of feedback.
Yeah, I know. I'm going to turn off my mic, or I might have to just stop. You know, I'm going to leave that. Never mind. Bad idea. All right, I'll be fine with this. All right, can everybody see the slides?
Yes.
Okay, cool.
So
first off, I wanted to thank everybody for joining tonight. I wasn't on in the beginning, but it looks like we have Mrs. McQueen and Mr. Hellman. Is that correct?
Yes.
Yes.
Okay,
and we have Sandra Perez on the line as well.
Oh, okay. Welcome, Mrs. Perez. All right. Awesome. Okay. Everybody can hear me okay?
Yes.
Awesome. Well, first off, I want to thank Christine for inviting me. And I will kind of jump right into it just so we can get the most meat out of the night, okay? Or the most meat out of my part, so you guys have time to ask questions, okay?
Okay.
So a little bit about me. My name is John Nagatsuka. I've been a licensed physical therapist since 2008. But prior to being a physical therapist, I used to be an engineer. So I kind of look at things a little bit differently than some of the other physical therapists. So I don't know if any of you have had any experience having physical therapy for an injury. Have any of you guys ever gone to a physical therapist before?
No.
Yes.
Okay. So whether you have the experience or not, just like any nurse or any doctor, everyone kind of has their certain skill set. And it doesn't take away from someone else's forte. It just means that you just kind of excel in something else. But what I want to explain is that the way I explain things may not be the only way. So I'm going to little disclaimer that sometimes you might get confused because one physical therapist or one nurse or one doctor says one thing, and sometimes you do get confused. Confusion sometimes does happen in what we do, but if you don't know the answer and if you are confused, I want to let you know, ask your doctor, or ask some professional first before you make any decisions. Is that okay?
Yes.
Perfect. I'm a staff therapist also at Englewood Health. So as soon as I graduated college, this is my first job, and I'm still working at Englewood. And in my journeys as a therapist, I wanted to grow my skill sets. So I went to Holy Name, and I'm also a home care therapist with Holy Name. One of the blessings that home care has provided me, and you'll see later in my presentation, was that it brought me into my patient's world before they got to me as an outpatient therapist. And I'll repeat that. Up until me doing home care, I had no idea, honestly, I had no idea what y'all were going through at home. But I will bring that into the presentation because I find it very important, because sometimes people feel that they're out of the loop, so they're not getting any benefit. Or some people are stuck at home and they're stuck and they really don't have any place to go. So I'm going to share some light on that. Okay. And I have my own company as well. But I will just skip that because that's not important right now. So the most important thing I wanted to ask is, and I can't see you guys right now, but the first question is what is your activity level like? So just from listening to some of your guys' discussion, sounds like some of you guys are fairly active. Is that correct? Seldom, somewhat, moderately, extremely active. What would you kind of say you guys are?
Fairly active.
Okay. And then Mr. Hellman?
I would say somewhere in between somewhat and moderately active.
Okay. And then Ms. Perez? And you don't have to answer if you don't want to. By all means, you don't have to answer if you don't want to.
Yeah, she is.
Okay. So the next one is how many of you guys are currently exercising? So it sounds like some of you guys are walking. Are any of you guys working out by any chance?
Nope, just a walking.
What do you mean
Okay.
as far as doing resistance training and stuff?
Or anything, and we'll go over that. So this is kind of like a leading question, but I just want to see what your activity is.
Yeah. Exercise, doing exercise, walking and stuff like that.
Okay. So a lot of times, some people don't like to exercise, and that's quite honest. A lot of people don't want to do something they don't want to do. Some people like to do what they want to do, but they can't do it. So there is a difference. Now, this is a strange question, but I have to ask it. Because as a physical therapist, some of my patients already come to me knowing everything before I even see them because of Dr. Google and Mr. and Mrs. YouTube. Okay, so I'm sure most of us have already gone to YouTube to research stuff. And if you haven't, most people have already done that. Does that describe you guys?
Yeah, I do Dr. Google.
So the fact of the matter is there's a lot of information out there. The problem is that some information is good, some information is misleading, and some information is really bad. So you kind of got to use your thinking hat and kind of take the good with the bad. And if you're in doubt, what do?
Get out.
Ask a professional just to kind of clarify things. Okay.
Yeah.
All right, cool. So moving on. So living with diabetes. And I don't know if any of you have been recently diagnosed with diabetes, but it can often be very confusing. And you're not alone. And it does get confusing because maybe a family or friend or someone tells you one thing that you're supposed to be doing something. And then your next friend tells you the exact opposite. So it does.
Do a tech. It's about.
Say it again. Say it again.
Liz Collins shows us how the.
Hold on.
I'm sorry. Is someone trying to say something? I'm getting some feedback. I'm not sure if that's somebody or.
No.
Okay,
I think
we're good.
Mhm.
Yeah.
Okay, so so my hope tonight is to try to help. Okay, so I want to lead with this. Empowerment is everything. Okay, let me help you, right, and then you help yourself. But I think the people that are here right now is you've already taken the first step of getting educated, and you're here. So I want to applaud you guys for doing that right now. Okay, so that's awesome. But you got to start from where you stand, and then every day, hopefully, it's another step forward. Is that okay?
Yeah.
Yeah.
Perfect. So before I begin, I wanted to go through this thing because once so I was trying to learn stuff, and someone showed me this, and I thought it was very profound. When you understand how we learn, it kind of makes it easier to accept things for what it is. Now, there's things that we know and then things that we don't know. And I will put it out there like this. If you ever learn a new sport or a new musical instrument or anything like that, the first time you do it, you're kind of pretty bad, right?
Mm-hmm.
And then as you practice, you get better. This is the same thing. So in the beginning, you don't know what you don't know, or you don't know what you really can't do. See that number 1 right there, that red
Mhm.
stop sign?
Mm-hmm.
That's kind of like where we're starting if you don't know much about anything. You just don't know what you don't know. But then you realize that you know what you can't do, and that's the number 2. Does that make sense?
Mm-hmm.
Yeah.
And then what's nice is as you start start applying the things you learn, you start taking applying what Christine says and what Mary says and what Danielle says. You start applying all that stuff. Now you know what you can do, which is pretty nice because now you're getting a more conscious awareness of where you're at. But this is what's special about learning. Number 4. This is where all the magic happens. You don't know, okay, what you can do. It becomes automatic, okay? You're going to get into this habit every day, taking your blood sugar numbers, hydrating yourself, getting in a routine of exercises. It almost becomes second nature. Does that make sense?
Yes.
Yes.
So that's where hopefully I want to help you on that journey. So no matter where you are, don't beat yourself up. I want to take you through that journey together, okay?
Yeah.
All right, cool. So what is the difference between physical activity and exercise? Okay, so first, let me kind of put a little line here horizontally here, okay? On one end of the spectrum, you have somebody that's very sedentary, somebody that maybe doesn't get around too much. They can't get up too much, okay? So we call them very sedentary, or we call them couch potatoes. You know, I'm sorry, but sometimes people are couch potatoes. But then you might get someone on the opposite end who's very active. So you see the guy that's running. But the biggest question is, what's the difference between somebody that's sedentary and someone that's very active? So I've often heard pain is a limiting factor. Are any of you guys in that boat?
Yeah.
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 Mhm.
A little bit? Okay. So I've been a therapist for a long time, and I don't know, since I've been a therapist, I don't know if I've ever been a day without pain, you know, just from injuries from sports from long ago. But sometimes the pain limits you. Sometimes the pain motivates you. And I'll explain that later, okay? Sometimes we have arthritis. Anybody here have arthritis?
No.
Okay, good. Or another injury. So sometimes injuries limit our activity, correct?
Mhm.
Yeah.
Of course, diabetes is also a limiting factor because it affects a lot of different systems. And of course, if you have heart disease or heart issues, then also limits your activity. But let's put that aside. So take a look at that little house in the middle. This is what my home care experience comes in. A lot of people are homebound. They can't get out of their homes. Now, you might know some people like that. Maybe you're one of those people exactly as I described. You're stuck at home, okay? So you're only limited by your activities of daily living. Going to bed, sitting in the couch, going to the living room, going to the bathroom. You're kind of stuck in the house, okay? But If you keep working at it, you keep on working and you keep on walking, hopefully you become a community ambulator. Okay, that means you're out and about. You're not limited to your home. Okay, so right now, would you guys say you're more stuck at home, or are you kind of community active?
Community active.
Cool.
I'm in
Just a quick-
between.
Okay, and it's fair, especially with coronavirus. Sometimes we
Yeah,
are forced,
exactly.
right? So
Yeah.
we'll accept that. Okay. Now we're a community ambulator, but now we want to become that weekend warrior, or we want to be very active like we once were, or we want to become. Okay. So we want to be active as possible, but we also have to be safe. But we have to start from where we stand. And I say this all the time to all my patients. We are all products of our environment, good or bad. Good or bad. Okay. So what is exercise? The primary focus on achieving health-related goals has been described for improvements through exercise, improving our cardiorespiratory fitness. That's the way we breathe, the way our lungs and our heart work. Okay. Our body composition. Okay. Sometimes we've heard that word BMI, our body mass index. Usually it's our weight per our height. Okay. And our body composition. Now, some people they're very skinny. Sometimes people are obese. No matter where we are still fighting our own challenges. No matter if you're skinny or if you're heavy. Okay. Someone that is heavier has a lot more work to do, but fitness can still be achieved. Okay. So we're going to start from where we stand. Fair?
Mm-hmm.
Okay, cool. So the goals for exercise for our diabetes actually comes down to one important thing, is the controlling of your glucose. Now, we talked about earlier how medication and diet helps. I'm taking that third part of exercise and how to do it safely. Any questions? You guys are okay?
Yeah.
Yeah, we're
Okay.
good.
Okay, awesome. So outcomes have shown that when you exercise, part of the problem, again, with diabetes is that the insulin doesn't work well. But with exercise, sometimes the exercise helps the efficiency of your insulin. Okay? But we have to remember that insulin can change based on earlier on what we eat, what our initial blood sugars are. Earlier, they talked about taking a snack if it's too low. So we're going to talk about that, okay? And then sometimes people exercise so well that people have actually reduced their insulin requirement. But of course, you have to talk to your doctor first, okay?
John,
Now,
John,
yeah.
but
Yes.
they can also, a lot of times with exercise, they can also decrease their medications, not
Yes.
just insulin.
Very good. Very good point. Was that Mary?
Yes.
Awesome. Thank you. Yeah, it's a very good point. So there is a lot of benefits, and you reduce the dependency of things that you may no longer need. So that's a very good point. Thank you very much. So can you guys see this pyramid? Is it hard to see on your screen?
I would say it.
Okay. So the activity pyramid I found on the USDA Foods Guide pyramid, I thought it was very fascinating. So at the base of the pyramid, level 1, that is the blue area. Okay. Now that is a big base because that's something that we can do more often. And it's also something that is less intense. So by the show of hands, who would like to do more of the easy things first? We all do. How many of us likes to do those intense things? If it's pretty intense, we don't typically do too much of it, correct?
Yes,
Right.
So if you take a look at the bottom line, if you go to the bottom, on my screen is right, there's a person walking. So if you're walking, you could do that almost every day. And we pretty much walk every day if we are out and about in the community. Is that correct?
Yeah.
So now some people are stuck at home and they can't get outside, or sometimes you may not want to go outside. So the next position over, you see a guy doing stairs. So now stairs is more challenging because it's more intense, correct?
Mhm.
So here we go. We have someone that's walking, and now we have someone that's going up and down the stairs, okay? Now, sometimes people become more community capable, and sometimes maybe you could pick up a sport, okay? Maybe golf, okay? Something low level. Does that zoom up if I do that, can you guys see that better?
Yep,
Yeah.
Yes.
that's better.
Right. So fishing, fishing, I got into this summer with my daughter, and it's like the most relaxing thing in the world. I don't know if you guys have ever done that,
Yeah.
but it's pretty cool. I didn't catch anything, so then it got really stressful real quick. All right. Okay, but that's the fact. Okay. Now level 2, now we go into something. Okay. Oh, let me go back to this first. Let me explain this. FIT. F is frequency, I is intensity, and T is timing. So let me explain to you. Frequency is how often you do something. Okay. Intensity, okay, is how intense it is or how strenuous it is. And timing kind of goes along with frequency. So if you take a look at F on the bottom, the blue, that's like 5 days a week. And the intensity is moderate or easy. And the duration is about 30 minutes. So it's a low level thing done almost every day for 30 minutes. Does that make sense?
Yes.
On the blue part, okay? Now, if you go up to the green area, you do it less often. That's why it's down to 3 to 6 times per week, okay? The reason why is because it's more moderate, it's more aggressive, it's a little bit more intense. But also look at the time, the duration. It's not 30 minutes, now down to what? 20 minutes, okay? So sometimes people say, well, I don't have a lot of time. So what could you do instead? If you don't have a lot of time, you could do a shorter thing, more intense. Does that make sense? Does that make sense?
Yeah.
Yes.
Mhm.
Okay, cool. And there's just some examples. There's like sport examples. Now, some of these may not apply to you, but we're going to talk about some other ideas for you later. Okay. Now, level 3. Okay. There's 2 parts of this: flexibility, and that's basically stretching. Now, if you look at that, you could do that almost every day, right? 3 times a week to 7 days a week. You could stretch every day. Now, do any of you guys stretch right now?
Yeah, I
No.
try my best.
Right. And you're saying earlier you're having tight hamstrings. So we're going to talk about that. Okay. We're going to talk about how to do that.
Mm-hmm.
All right. So stretching helps to loosen up the body, helps you to kind of loosen up and prevent injuries. Okay. Now, stretching again, you do that every day. It's not a long duration. It's usually a couple seconds. Notice it's not minutes. I was looking, I was like 15 minutes. No. It's 15 seconds, 60 seconds. It's not long. You do a couple times and you're good to go. All right. Now, that red part on the right, that's for strengthening. That's resistance training. Okay. That's weight training or calisthenics. All right. That's for endurance. Only done twice a week, 3 times per week. Okay. You're overloading muscle to make it stronger. So we don't need to do that every day. Because what happens if you do something too much? It could lead to a
Injury.
Yeah, exactly. And is injury good or bad?
Bad.
Bad, right? So think about the logic. You take 2 steps forward and then you take 3 steps back. Are you ahead or are you behind?
Behind.
Behind. Right? So work smart, right? So, and then at the very top, I thought it was kind of funny. Inactivity. I'm like, why the heck is that level 4? So this is kind of like what you don't want to do a lot of. But if this is your way to relax, by all means, you can relax if you've done the other levels first. See how that works? You don't lead with inactivity. You lead with activity to deserve inactivity. Does that make sense?
Yeah.
All right. So the turkey trot before the meal. Okay. All right. Moving on.
Actually,
So
John,
I got to give you.
can
I'm
I
sorry?
ask you a question? John, it's Christine.
Yes.
I wanted to ask you because I've heard differing opinions on this. Is it better to exercise then before the meal or after the meal? Does there make a difference or not not for our purposes?
That's a very good question. So I think it depends on the activity. So, for example, swimming, we've all been, if you guys are swimmers, we've all been told don't eat before you swim because you're going to cramp up.
Mhm.
I'm a runner. I don't eat before I run, but I'm very hungry when I'm done. Okay. So it kind of depends on the activity. And I'm going to talk about that a little bit later, but sometimes people eat a banana before they work out or they need something to get them started. But it ties back, especially for the diabetic community, is perhaps start with your blood sugar first. Okay. Start with your blood sugar first and then decide whether you need to eat first before you work out, or if your numbers are good, you may not need that boost snack, but you might need a mid-workout snack. And so it kind of goes on hand in hand what you had said earlier.
Okay.
So there are two camps. Some people like to work out after the meal to burn the calories that they just ate.
Right.
Others
Yeah.
work out to speed up the metabolism. So when they do eat, it burns it better while it sits in their stomach.
Right.
I say kind of play around with both, right?
Okay.
See what your response is, because each of us are individuals and each of us are unique. So your response might be different. Okay.
Okay. Thank you.
But that's a great question, though. So before you begin any workout, you want to kind of consult with your PCP or the quarterback first to find out if there are any do's and don'ts based on your particular situation. Once you check with your doctor, then the next thing you're going to do, of course, we talked about, is to check your blood sugar.
Yeah.
See where you are, right? You guys are doing that right now?
Yes.
Before you work out, just check your sugar, okay? And if you're not in that habit yet, you may want to get into the habit just to kind of see where you are, and then just to play around, see where your blood sugar goes during your workout if you have time, and see where your blood sugar, see how your body behaves and how your body responds to your activity, okay? But here are some warning signs. If you ever get faintness, or if you ever get dizzy, okay, or if you ever experience any shortness of breath, or any type of pain or discomfort, what should you do? You should time out. Take a time out. Figure out what's going on. Maybe you did a little bit too much too early. Just pace yourself, okay? See how your body responds, okay? And the other thing is, before you go out to do your activity, warm up. And we're going to talk about warming up and how to warm up a little bit later.
My screen went dead.
I'm sorry?
I can still hear you, but I can't see you now. Go ahead.
Okay. Am I also on? Is my video also on at this time?
Yes.
Can you?
It's live.
Okay. Cool. Okay. Okay.
What happened?
Can you guys see that?
Yeah.
Can't see anything on mine, but I can hear you.
Yeah.
Okay. If that happens, you may want to. It's happened to me before. Sometimes people log out and log back in just to reset everything. I don't know if it's a Zoom thing.
I'm not gonna touch it.
Okay. All right. That's good.
I can still hear you.
All right. So what I'll do is, so you can't see, I'll try to read everything that I wrote up. Okay. So the next title is cardio exercise. Okay. So what is cardio exercise? There's two types of exercise. I call it aerobic exercise and anaerobic exercise. The difference is aerobic exercises is with oxygen. Anaerobic is without oxygen. Okay. So the first level, aerobic exercise, is a lower level exercise. It's literally a walk. Okay. And my rule of thumb is it's usually not intense. Usually it's about 50% effort, 60% effort. Okay. There's a thing here I put called max heart rate. If you guys want to know what your max heart rate is, there's a simple formula. You take the number 220 minus your age, and that's your max heart rate. Now, most of us will probably not be going anywhere near our max heart rate if you're not conditioned, especially if you are more on the lower end of sedentary scale. You're probably not going to want to play around with max heart rates. But the idea is pace yourself, start slowly, and build yourself up. The fuel for this type of exercise typically are your fats and your carbs, your carbohydrates and your fats. That's where you get your energy from. That's where the source of your energy comes from. And examples, again, are walking, jogging, an easy bike ride, an easy swim. The way I remember this is if you can walk and talk, then you're doing okay. Okay?
John,
Anaerobic,
John,
yes.
it's Mary. Should you be able to talk normally? Should you be able to have a conversation? Should you be able to whistle a tune?
I think that depends on the, that's a great question. For me, when I first got back into running, I did not have full sentences. I basically had one or two words that came out because I was extremely out of shape. As you get conditioned, your body's ability to maintain that endurance, you will find that you will be able to have full conversations per se while you're working out. So that's a very good question. I kind of think it depends on your level of conditioning and where you're starting from. But in the beginning, maybe a few easy words, you know, how you feeling? I'm good. How you doing? I'm doing awesome. I'm doing really good. I can keep up. You're gonna find that it may be a few words to a full-blown conversation. Kind of depends on how you are excelling. Okay, but that's a good question.
Hey, I have something to say also.
Yes, sir.
Like, you know, I'm not in the best of shape right now, you know what I mean? But, you know,
Yep.
I come from an athletic background. I used to be a personal trainer back in the day.
Oh, cool.
And when I work out, when I go out and I usually do an hour, like I was telling Christine and Mary, you know, I get out and I do like an hour, an hour walking. It comes out to about maybe 4 miles. And one of the miles I actually jog. And I try to keep my maximum heart rate anywhere between 65 and 85%. All right. So
That's great.
So my question is, like, is that a good idea? I mean, it's just the intensity level that I like to go at. You know what I mean? But there was like my maximum heart rate, 85% of my maximum heart rate is 145, right? But once I tried to increase the intensity, I got it up to like maybe 151. And I got a little nervous because it went above 85, like, you know. And I was a little nervous about that. I didn't know if I was going a little bit too hard for my shape,
Right.
you know, me being
Right.
in shape of you know. So
Yep.
I was just wondering, what do you think about that?
So one of the things that is very interesting is that a lot of times people take a lot of medications.
Right.
Medications does funky things with our heart rate,
Mhm.
right?
Okay.
So I would consult with your cardiologist if you need to, but
Okay.
in general, I try to stay on the lower end.
Okay.
Why? Because you're playing with the blood sugars and diabetes, right?
Okay.
And you're also dealing with medications that might clip your heart rate at a different area than normal, right?
Okay, yeah.
So there's things that are normal and not normal. I'm not calling you guys abnormal, but it's not normal in the sense that you're not diagnosed with diabetes, right? Or you're diagnosed with diabetes, so things are already a little bit skewed. So you have to adjust for that diagnosis. Is that correct?
Yeah.
I got you.
So a better way, and I'm getting to the next slide on how to deal with that. It's called RPE, but I'm going to get into that next, okay? But that's going to be on the next slide, okay?
Mhm.
So the fuel, going back to anaerobic, is that oxygen is not sufficient to fuel the exercise, right? So you're now going to be going up from the fast to carbs to now carbs and something called more proteins, amino acids, okay? This gets really complicated. You might actually need to sit down with someone that explains this better than me, but the idea is it's more intense. It builds, lactate is cell metabolism. So lactate acid is when if you don't stretch after a workout, you get that burning muscle soreness after a while, right? So that's what lactate is. So these are all good things, okay? And that's more like lifting, more intense, resistive exercises. That's more anaerobic because you're not typically having a conversation while you're doing jumping jacks. At least I can't, right? You're not having a conversation if you're going up and down, jumping up on boxes and stuff like that, right? So the question is which is better? Studies have shown, especially if you're a personal trainer, you could probably agree, both have its benefits. So both have its benefits. So on certain days of the week, you might want to go just with a walk. Other days, you might go with something more intense. On another day, you might go back to something that's easier. So you could play around with this pyramid here, and you could play around with what works for you, what works for your schedule, what works for your lifestyle, what works for your glucose response. Okay?
Mm-hmm.
I'll bounce back now to resistance exercise. So someone asked me, John, should I start lifting weights right away? I'm like, no, you never start lifting weights until you know what your natural motion is. Because if the natural motion, right, range of motion is already compromised because of an injury, adding more weight to something that's injured, does that make sense to do?
Nope.
No, because then that will lead to probably a bigger injury. So sometimes your own body weight in and of itself is enough resistance to be considered strengthening. Does that make sense?
Yeah.
Okay. So usually the gist of all this, you start lower with something that is easy, and then you progress to something that's harder when your body builds a foundation. It builds a baseline. It builds a baseline so you can do more later. Okay?
Right.
Cool. So the basic formula, I already talked about this already. For cardio, you're looking 3 to 5 times per week, okay? Duration, 20 minutes to an hour. Intensity, about 50% to 80%. Much like Mr. Hillman said, he brings them up to 80%. It's going to be a short moment. It's not all the time, okay? Now, for resistance, you're only going to do that twice per week, something less, and you're going to be resting 48 hours in between. So it's not back to back. It could be every other day or every other 2 days. You got to give your chance for your body to recover. Recovery is very important with anything we do in life. If you do too much all at once and you don't allow your body to recover, it's too much. Our body can't handle that. Okay? And usually for resistance areas, we're looking on a single muscle group. Our glutes, our thighs, our chest, our arms. You're just like working on certain muscle groups. Sometimes you can do combinations when you get better. Okay, combination muscle groups. Any questions so far, so good?
Mm-hmm.
Okay. So the biggest thing is when you are exercising and you're new to exercise, sometimes the response is not what you expect. So there are signs of hypoglycemia and hyperglycemia. Have you guys heard those words before?
Yeah.
Yes.
Okay. Can you see the slides on the blue side for hypoglycemia?
Yeah.
Sweating, being paler or pale, irritability. I call it, what do you call it? Hanger pains, hungry and anger, irritability. That's me at work. Yeah. Lack of coordination and sleepiness. Okay. So if you're finding those symptoms a lot, that might be because your sugar is bonking, is dropping down too low. So in that case, you might want to bring a snack and just refuel, or take a look at your blood sugar with a real test versus just assuming, get a number and then see, oh wow, I'm really low. Let me take a snack. Okay. On the contrary, if you're hyperglycemic, that's when you get the dry mouth. Like me right now, I have the dry mouth because I'm talking too much. And then you have the increased thirst. Okay. Weakness, headaches, blurry vision. And sometimes you got urinate a lot more. Okay. So these are just different signs. And I don't know you, but you know you. You know what you're dealing with. Okay. So you just kind of keep track of these things. Okay. Keep track of, see what your responses are. All right. But when in doubt, just do a simple blood test to see where you're at for real. Okay, it's pretty quick. Okay. Now, here's the RPE scale. Now, this is something that we use all the time in terms of our response to the activity that we do. Because with some medications, you can't use heart rate as a measure because it's already changed. So I use the Borg RPE scale. Is the rate of perceived exertion. It's literally, in your own words, how hard do you feel you are working? So the lowest number on the scale is actually a number 6. It's a weird scale. It goes from 6 to 20. Now, there's a lot of different versions of the scale from 1 to 10. But honestly, I like the 6 to 20 scale. Because when I say what your pain like and people go 10 out of 10, it's just kind of remote. It's kind of like automatic. They just say it because, oh, high pain equals 10. This is a weird scale. 6 to 20 is a weird scale. You got to think about your answer. Number 6 is no exertion, and it's basically you're sitting and resting. That's the low end of the scale. On the high end of the scale, that's number 20. That's your max effort. That's your max effort. Anything in between, you're building low to high, is going to be extremely light, very light, around number 9. You keep working up into the yellow, 12s, 13s, 14s, 15s, 16s. That's when it gets a little bit harder. In the orange, at the bottom of the scale of this picture, it's very hard. So where do you think we're going to probably start off with? What colors do you think is a good place to be?
Green.
And the 6 or 7.
Yeah, so you're gonna be on the lower end of the scale. You're gonna probably be in the green and the yellows. Okay, be light. Make sure it's light. Make sure it's comfortable. Get used to it, and then you work your way up. Okay, challenge yourself. But you can use this RPE scale to judge for yourself how you feel. Okay.
All right.
And another thing to note for, as I have here, is breathing. How are you breathing? What's the response? Are you huffing and puffing? Are you gonna pass out? Right? Are you experiencing pain? Are you experiencing discomfort? They're warning signs. The body's telling you what to do. The body's telling you what not to do. Okay? Going to move on. I'm not sure if I'm going too long here. I don't know how we are with time.
We are over, but how's everybody? I think everybody is engaged. How are we feeling, everybody? Is it
Well, okay.
okay?
Good.
If you have to sign off, that's fine. But it's really interesting what you're talking about, John. So I know I'm learning a lot.
Okay, great. Awesome. So one of the bullet points that we want to talk about is how to prevent complications. Okay. So again, always going on. I keep beating this up because you have to know your sugars. Okay. And we don't know as we work out how our body's going to respond until you figure it out. Because each of us are different on any given day. It could depend on the type of meal you had, depends on your hydration, depends on your workout. So just basically stay in tune to what your response is. Okay. So nutrition is important. Okay. Medication compliance is very important. Okay. And when in doubt, again, go to your quarterback, go to your primary doctor, go to your endocrinologist and find out, okay, this has been happening. Is this normal? Should I be expecting this or not? Okay.
So
what do you say?
So
Go ahead.
John, I just want to say, when you check your blood sugar, some people may find that their blood sugar may go up initially as a result of exercise, but then it can also go lower hours and hours later. So if it goes up, I don't necessarily want you to be concerned about it, but just necessarily don't freak out if the number went from 100 to 200, and then, but later on, you may have a lower number.
Right. That's a good point. That's a very good point. So sometimes, and that's a very good point. Sometimes we get too consumed by some of these numbers and that we're afraid to do anything.
Absolutely.
Right?
Absolutely.
So I don't want to lead that. I don't want to scare you. So I do apologize if I've kind of led that way, but that's a very good point. I think going back to that other slide of kind of knowing your response, more of the sweating, all that stuff, kind of see that's kind of like a better indicator sometimes with the number itself. Mm-hmm. Okay. Because we do have sometimes a delayed response. So that's a very good point. Thank you so much. That's very good. Thank you. So we're going into now things you can do, and hopefully you guys can see it. I thought these are very funny slides here. So my battery's gonna die is weird. I'm charging. Let me just check to see what's going on because I just saw that it's not charging. So let me go back to charging this thing. Make sure we're good. Sorry. Because I don't want this to power off. Okay, I'm charging. Sorry. So yeah, so basic home equipment. I think most of us have these things in our house: a chair, a couch, a doorway, a wall, kitchen counters, water bottles used for weights and pillows. Okay, so basically, whatever you have around, you use. Don't go out and go spend money on stuff that you don't need to buy. I guarantee you're gonna be able to find resistive exercises based on what you have in your house already. Okay. So here is an example of a seated exercise. Now, who earlier said that he couldn't see the screen? Is your screen back up, or are you still in?
I'm back up. I'm back up.
Okay, great. Okay, good. So the first picture, the MC Hammer skeletal picture on the couch, that is probably my very favorite exercise for home care. It's someone scooting along a couch. And I won't do this today, but I will give you this challenge. It's a challenge of seeing how many times you can scoot across your couch or bed and see if you're breathing heavy. I almost will guarantee if you go once or twice, because I did it myself and I was huffing and puffing.
How?
Right? It's an amazing exercise. And I actually learned this from a patient because she was afraid of walking. And she would scoot along the end of her bed to get closer to the bathroom. So there's a less risk of walking. Very smart patient. And I tried that and I was huffing and puffing when I did a couple laps. So I now encourage all my patients to learn how to do this. And the reason why this works, remember earlier I talked about major muscle groups? This hits every major muscle group if you use your arms and your legs to scoot across the couch. So if you could pick one exercise, guess what? This is the exercise, okay? It's pretty funny. It's pretty silly, but it does work. Now, the next one is just see the floor presses. Most PTs teach the marching exercise. Like they march from the couch. I like the other one where you're actually pushing the floor down. So while we're talking, and while you're on this Zoom call, I want you guys to, if you guys are sitting, to start pressing the floor with one heel into the floor. Where do you guys feel that?
In my thighs.
Exactly. What muscle do you need to stand up? Your thighs. So if you do nothing more and then you're watching TV and you want to do something during a commercial, guess what? You could use floor presses, alternate. If you do it at the same time, well, guess what? That's how you stand up. Okay. The next exercise is the knee kick with the foot wiggle. What happens here is if you kick your leg out, and you can do these with me if you want to. If you stretch your leg out and you wiggle your foot, one, it helps with circulation. And on back of behind your knees, are any of you guys feeling a stretch in your legs?
Yeah.
Yeah.
Good. Mr. Hillman, welcome to your hamstring stretch, sir. You guys feel that?
Yes.
Yeah.
All right.
So it's crazy because we think it has to be this very complicated thing that we need to do. It's sometimes the most simplest things, right, in the world.
Man, turn this down for me right quick.
No, he's not. Okay.
Are we good to move on?
Yes.
What about, no, John,
Oh. Yes.
what about, so the arm reaches are just like the woman's doing? You just put your arms out and then twirl them?
So arm reaches are done a lot of different ways. The reason why I left it at shoulder level, because a lot of times people have shoulder pain. And if you start doing arm reaches to the ceiling, sometimes people have shoulder pain that they can't do.
Okay.
So if you can't raise your arms above your shoulder, then stay below your shoulder level, okay? but it's nothing more than bringing your arms to your side and just rotating your hands up and down. Okay. There are tons of exercises you can do with this, but I started with something that was probably the easiest to do and the least painful.
Okay.
But you can do elbow bends, right? You could do opening and closing your fist. You could do all that stuff. Okay. Just one example, right? So moving on, standing exercises. Okay. The order is kind of weird.
I'm sorry. John.
You guys, are you there?
Yeah, I'm here. Hey, I have a question. It's not just my hams. I just want to say it's not just my hamstrings. Like my whole posterior chain is like just really tight. You know what I'm saying?
Yes, sir.
So I was trying to see what can I do for that, because I mean it does deter me sometimes. You know,
Okay.
like my body be aching from my whole posterior chain and my quads as well. You know, and
Right.
you know, so I was just wondering what can I do for that.
So let me answer that question at the end. So let me
Okay.
get through this, and then I'll answer that question for you. Okay.
Okay, no problem. Yeah.
All right. Good question.
Okay.
So the first picture of the lady tapping onto the box, that's a higher level exercise. And if you don't have a box, what else could she do? She could just be standing and just doing toe taps on the ground level, right? Toe taps to the front. And while you're sitting, you could do these toe taps while you're sitting. Toe taps to the front, toe taps to the side, right? So every direction matters because it's going to help with stretching. It's going to help with coordination. It's going to help with circulation. Does that make sense?
Yes.
And then also heel raises, okay? That's where the kitchen counter or back of a chair helps, because you can do heel raises by holding onto something so you don't lose your balance. So I always preach safety first. So if you hold onto the back of a chair or a table, you could do these heel raises up and down, okay? But again, if you have any pain or it hurts, you're gonna stop. Now, these hip kicks, they can be done in 4 directions: behind, to the rear, to the side, and to the front. Okay, so you could do standing marching, you could do side kicks, and you can do rear kicks. Okay, but again, if it hurts, you don't do them. Okay. Laying down exercises, I call them the supine exercises. There's a tons of things you can do, and just for the sake of time, I'm gonna have. I think you guys are gonna get a PDF of this anyway, but for the sake of time, I'll just go through a couple of these. My favorite exercise is the biggest one that gets the best bang for your buck is the bridging. It's actually the letter F. It's the last one. So are you guys familiar with bridging?
No.
So basically bridging is you keep your, you lay on your back, you bend your knees, you keep your head on the bed, you keep your hands on your bed or your floor, and you're just literally lifting your butt off the floor. But you're driving through your heels and lifting your butt off the floor. Okay, that's going to work your hamstrings, which is the back of your legs. It's going to work your butt muscles, and it's also going to stretch the front of your legs. Okay, so it does work everything. All right, it's a very good exercise if you don't have a lot of time. But the other exercises are just as good. Quad sets are basically just squeezing your thigh muscles. The glute sets, basically just squeezing your butt muscles, just squeezing and holding. The heel slide is basically good for circulation and loosening up your knees. Okay, so slide your heels on your bed or on the floor. Ankle pumps is literally getting circulation into your toes. Okay. Leg raises, leg raise one leg at a time. Don't do both legs at the same time. Do one at a time. Okay.
Yep.
Sideline positions. Now, again, any of these positions could work. Some of you don't want to get on the ground, then great, pick up chair exercises or standing exercises, or pick what works for you. Sideline exercise, usually for strengthening the hips. Okay, so side kicks laying down. Okay, clams is where your heels are together, your knees are bent, you're just basically opening, closing your knees. That's a groin stretch, or also a glute strengthening exercise. Circles, a little bit more dynamic. Keep your legs straight. Do circles with your toes. Hip, okay. Hip extensions, just basically doing the mule kick on your side. Just doing kicking back on your side. You do whatever works for you and whatever space you have in your house or in your place, okay? The prone exercises, that's when you're facing down, Okay. So the first exercise is the prone hip extension. Literally, you're just kicking your legs to the ceiling. This is a hard exercise because one, your chest is pressed on the floor. Don't hurt your neck. Get some pillows, okay? And then do kicks from the floor, okay? Nice and easy. Or you could do knee bends, okay? The last one is someone doing a knee bend with resistance. Now, if you don't have bands, then you're just gonna, what are you gonna do? You're not gonna go out and go get anything. You're just gonna find something in your house that you're gonna use, okay? So don't, it's not about like spending more money. Just use whatever you have in your house, okay? Push-up positions, I like to do push-ups because you can push your own body weight. Now, if you haven't done a push-up in your life and it's very hard to do, you don't have to do it from your toes. You could try it from your knees, okay? If you can't do it from your knees, so then you could do it from your stomach. You just start from where you stand, or no pun intended, you start from where you're sitting, or you start from where you're laying, okay? You're just gonna start, okay? So you're gonna start, work your way up. 1 push-up, 2 push-ups, whatever you can do. Watch your breathing, okay? Don't hold your breath, okay? Don't strain. You work your way up, okay? Now, if you can't do it from the floor, guess what? What's an easier position than from the floor? The wall, right? Get to the wall, lean against the wall, do a wall push-up because you don't have to push your whole body weight, okay? So we can all start with that. Get to a wall and start doing wall push-ups to kind of work on your chest. You'll be working on your big major muscles in your chest and your arms. Okay. And then when you get really good, that old lady at the bottom, the older lady at the bottom, she's doing something called a plank.
Oh.
Right? She's doing plank. She's holding her position. Okay. That's a really good exercise. If you have back pain, this is the #1 exercise for back pain, at least in my book, to get your core stronger. Okay. It's a good exercises to
John?
work. Yes.
How long should you like? So I'm familiar with planking. Actually, I try to do it with my son. He does it for Taekwondo. But how
Awesome.
long should you do it? Or does it not
So that's a very good question. A lot of times people do planks and they hold it as long as they can.
Okay.
Most people get tired. And again, it's a conditioning thing. So I can't give you a number, but there's different ways to challenge yourself.
Mhm.
So instead of just doing a plank from the floor,
Mhm.
you could do a plank from, something that's less, if he's more advanced, you could do from a ball, from different surfaces. You could do planks in different positions, but most people could start with 10 seconds, then they work up to 20 seconds, and they work up to 30. And then some people work up to like 2 minutes and 5 minutes. 5 minutes is way beyond me.
Okay.
I'm dead by 2 minutes. So
They're at Taekwondo. So my son's 8. They do it for a minute.
wow.
Yeah, it's tough.
It's really tough.
I'm not up to a minute yet. So
you start from where you stand, right?
yes.
Yeah, so it's a good exercise. Anybody else with another question, or you guys are okay for now?
We're good.
Go. We're almost done. Okay, so this is the motivation part, okay? Because it's one thing to start, but it's more important to finish, right? So motivation is key, okay? So you need to have a goal and purpose of what you're trying to achieve. If you without a goal, guess what? It's just a wish, okay? And someone said earlier, you may be working out with a friend or a family member, work out with somebody else, okay? And do what you like, If you like to dance, well, that could be your fitness. If you like to walk, that could be your exercise. If you like to jog, well, that is your thing. Find something, or bike, find something that you like that's fun for you, okay? Now, I had to throw this in there because with COVID-19, I think everybody's world has turned upside down.
Yeah.
And most of us are stuck in the house. And with the second wave coming, I fear that most of us are going to be forced to stay inside more, okay? But you do the best you can, all right? Go outside when you can, okay? We all live in different parts of places. You might live in a multi-family home. You might live in a single-family home. You might live in an apartment building. Everybody's scenario is different. Do the best you can with what you got, okay? But I do guarantee you this. If you go outside, what's the benefit of going outside? two major reasons of going outside: the sun
Some fresh air.
and fresh air. Perfect. Yeah. I work on the orthopedic floor at Englewood, and there's been record number of fractures this summer. And it finally dawned on me. Now, don't take this as fact, but it dawned on me that there was high number of fractures. And the only thing I was thinking is like, gosh, why are there so many fractures? I'm thinking, and again, this is not a medical thing. I'm thinking people are not getting outside and getting their vitamin D. That's just me. So off the record, that's what I'm thinking. Okay. So go outside, get some sun, get some fresh air. Okay. Now, here are my principles, and this is my spiel that I tell almost all my patients. Movement is medicine. Someone said that earlier. Okay. We are products of our environment, so make the best environment that you can. And if you're stuck in a certain environment, it is what it is. Make the best of it. Okay. Use whatever you have around home. It's not quantity, but quality. It's not how many you do or how long you do. It's the quality of what you put in. Mindset is everything. Goals are key, and you want to balance everything. Okay. Too much of one thing is no good. And remember, we're strongest as our weakest link. What I mean by that is we have multiple systems. They talked about earlier, and I didn't know about this. Moisturizing your skin, right? That's your skin system, right? Hydration, okay, very important. So we're only as strong as our weakest link. So we got to do the best we can to take care of everything, okay? Awareness is key. You got to listen to your body's response to what's going on with you, okay? Your response could be different than my response, okay? You are your own person. You got to fight your own battles. You got to see what your own response is. Try not to compare yourself to somebody else. Fight your own battles, okay? And I think, who was speaking? Christine was saying, were you the one talking about journaling and writing down your sugar numbers and all that? I highly recommend getting a medical book, document your journey. Because guess what? When we go to the doctor and we have that 5 minute in front of the doctor and we had an opportunity to ask a question and that 5 minute passed and we leave the office and we're halfway home, we go, oh gosh, I forgot to ask him or ask her this. Keep a medical journal and then track your stuff.
Actually, in our little kit, they gave us a self-care diary.
Awesome. That's great. I didn't know that. That's awesome.
Yeah. So, we can write down what we ate for breakfast, lunch, and we can write down our numbers.
That's great. That's awesome.
So
that's
we got that. We got that in the kit.
That's great. One of the things that you can do in that diary is on the right-hand side for each day is a comment column.
Right.
You could actually make a comment if you've done exercise that day.
Yeah.
That way you're also able to keep tabs of, I've done it 3 days this week for 30 minutes or, so that way you also seeing it in black and white also helps keep somebody a little bit more motivated.
Yeah.
That's great. That's great. So yeah, a lot of times you track whatever is important for yourself. Maybe the exercise you do, what you eat, what your sugars are. So you could take this as far as you want to, but don't put so much time in just to the journal. Do the activity. Make sure you do the activity.
Of course.
Okay, cool. So, but remember, consistency is key and support structure is very important. Okay. So if you're finding it challenging for you to find motivation, you may want to find if in your area, there are groups of circles, like a diabetic group in your area or other support groups, every town has their own thing, see if there are support groups in your area. Okay.
All right.
It sounds like this group here is an awesome group. So maybe you could start with this group. So.
Yep. Use us too. Mary, myself, Lee, we're all here.
Okay. Thanks a lot, John.
That's good. All right. So let me turn off. I'm going to turn off I'll go back to let me see. Turn this off. Can I do that or do you have to do that?
You have to make me back as host.
That's right. Stop. That's right.
There she go.
Are you guys, there we go.
Yes.
We're all back? Cool.
And I'm not back. No, I'm not back as host yet.
Oh.
Host.
Okay. Click on you. Boom. Make host. There we go.
Yes, I'm the host now. Okay.
Sorry.
So thank you very much. With that, I guess I'm going to open it briefly for any questions that anybody may have. I mean, I think we've been asking questions as we go along, but just in case anybody else has some ending thoughts or concerns or questions that they want to ask.
I know, Mr. Hillman, you had some questions.
Yeah, there was something Mr. Hillman was asking.
Yeah, my question was about I just had a question about the stretching. The thing is that you know, like just growing, just playing sports and stuff like that. I always had like a trainer that would stretch me out and stuff like that. And there's just some stretching that I do that I don't really get the benefits from it as I would if I had like someone stretching me like a trainer. And my flexibility is kind of not what it used to be. You know what I mean? So and also I have arthritis. I just found out I have arthritis in my knees as well. I was going to a physical therapist a couple of years ago because I had pain in my knees. And sometimes it does slow me down. You know what I mean? Sometimes it does slow me down. So I was just wondering if I had if there was someone that I could go to for that could help me out with my flexibility. You know, that'll help me out a lot.
You said you used to go to a physical therapist. You don't go there any longer, or?
Nah, it was a couple of years ago. You know what? I just stumbled upon it because I got, like I said, I'd had like tendonitis. You know, I played a lot of sports through the years, so I got all these aches and pains that I deal with. And one day I just walked past this office and I just went in and spoke to them. They took my insurance, and they used to hook me up to the electric stim machine, and then they would give me a really good stretch. And I mean, I benefited from that a lot. And like I said, that was about maybe I said about 2 or 3 years ago, you know, but I know I need to get some weight off for me, but getting a good stretch out will really help me out, you know.
So let me tell you this. Okay. So the way I do therapy, and I'm not going to go to specific stuff because it's not, it's, you should probably go seek professional help. But the biggest thing is that someone could stretch you, but what's more important is you stretching yourself.
Okay.
Right. So learn how to stretch. There's a lot of things on YouTube, and there's a lot, there's ways to stretch your calves, stretch your hamstrings. You said posterior chain. It's going to be your calves, your hamstrings, and probably your groin.
Lower back, glutes, everything, you know, the whole posterior chain. I'm familiar with stretching. I guess it's just that I'm just used to having like a trainer have me flip over on the prone position, and then he just puts that he stretches your quads for you, and then he lifts up your knee, and he gets your hip flexors and everything. It feels it feels
Mr. Hellman wants a good workout.
Hey, I'm trying to get a good stretch or something, so I can you know. I ain't no spring chicken no more. And that, and I mean that's just what I'm used to, you know what I mean? I'm just used to getting stretched so I could move around. I'm usually on a high physical level, you know what I mean? And now I'm slowed down because I do have a whole bunch of injuries that I'm dealing with, and I got a little extra weight on me now that and it's slowing me down, So a good stretch, stretching is important, and I stretch myself out, but just to have someone like a physical therapist or some sort of trainer that could help stretch me out professionally would be beneficial,
Yeah, I guess. Yeah, I guess if you have insurance, and go see if you can go out and seek another therapist again.
Another physical therapist. Yeah, I think I might have. I didn't know if we had someone in the network.
Right,
that was my question.
Yeah, so we can look into the dentist and physical therapist.
Okay, all right, cool. I'm trying to put a little team together so I could get it right.
Yes.
Be careful, Mr. Hillman will make you the team leader.
Nice.
So, okay, well, thank you for that. That's always interesting to look into our network too, to see what we have to offer.
Okay.
Anybody else, Sandra or Pamela, that you have any questions?
No, I'm good.
No, I'm good.
Okay, excellent.
Very good meeting. Very good meeting.
Oh, excellent. And John, thank you so
Yes,
much.
it was.
Very good meeting.
No problem. Awesome.
Thank you. Sorry,
I'll
sorry
probably
it was
be
long.
calling you again. John, I'll probably be calling you again.
That's fine. That's fine. Be happy to help.
Excellent. All right. Well, then the next, I don't have my schedule with me. Hold on. Let me check something.
So while she's checking the schedule, everybody please have a very happy Thanksgiving, a very safe Thanksgiving. Wear your masks, social distancing, be careful, wash your hands many times.
Mm-hmm.
One of the ideas, by the way, and I know you just got your schedule, one of the ideas if you're having anybody over to your house is to, like, in the bathroom, is to put paper towels out versus, everybody using the same hand towel to dry their
Right.
hands.
Yeah.
All right, just, and that makes a lot of sense. So,
Yep.
All right. Thank you. You as well.
Yes. Happy Thanksgiving, everybody.
Yup, happy Thanksgiving.
Thank you.
Health,
Thanksgiving.
happy, many blessings to you all.
Thank you.
you.
So,
Thank you.
Likewise.
thank you. Next week,
So,
we have an individual check-in. So that is going to be Lee calling you. Then on the 8th, the next Zoom will be on the 8th, and that will be Danielle presenting a full session on emotional and stress management. So that's another good one that we have tap.
okay.
And then after that, we have 2 check-ins and a closing Zoom. So, and I'll go through this again on the next Zoom on the 8th, but I just wanted to let you know next week is a individual check-in. So, you can talk about exercise. Lee will be following up on this presentation and what exercises you've incorporated, how you're feeling, your blood sugars, all of that. And then the week after on the 8th will be Danielle with emotional and stress management on the Zoom.
Okay.
Sounds good.
Okay. Again, thanks a lot, Danielle, for the stress
Yes.
exercises.
Yep.
John, thanks a lot for your PT
welcome.
skills. And Christine and Mary, thank you guys.
You're
And the rest of you guys, have a wonderful holiday and please be safe.
You too.
Likewise. Thank you so
Take care,
much.
good night, everyone.
Good
Bye-bye.
night.
Thanks
All right,
for
take
joining
care.
us.
Take
Good
care.
night.
Bye-bye.
Cal.
All right.
Bye-bye.
Bye.
Bye.